The answer is that this is the fetal head. Next, we will look more closely at the cervix. The internal os is the place where the cervical canal meets the uterus. You cannot see or feel the internal os on clinical exam. Here we have outlined the cervix to make it more obvious. We have also labeled the bladder and fetal head. Now we will remove this outline of the cervix so that we can show the cervical canal and the internal os. You should attempt to image the cervix in every scan until late in pregnancy, because an abnormal cervix can be a warning sign of problems during delivery. Sometimes you can't see the cervix well until late in pregnancy. For example, an internal os that is open, called funneling, is a warning sign of preterm birth. A cervix that is shorter than normal, less than 2.5 centimeters when imaged before 24 weeks gestation, is also associated with preterm birth. In both of these pictures, we can see the fetal head and an open internal cervical os. There is fluid in the cervix, so it looks anechoic. If the cervix had started to funnel and open only on the fetal side, you wouldn't be able to determine this on pelvic exam because the outer cervix would feel closed. You could see this easily by ultrasound, as in the image on the left. When the cervix opens even further, like the image on the right, you may be able to see the membranes bulging into the vagina when doing a clinical exam. This is what it would look like on ultrasound. Fibroids are also called myomas or leiomyomas. They are benign tumors of the uterus, but can cause problems like pain or bleeding depending on their size and location. They are fairly common in women, especially